founder of Dr Rajeshwari's clinics. Generally, hair transplantation, it's a simple and medical and cosmetic procedure. We can use for the male and female pattern of baldness. There is a very minimally side effect related procedure. Generally, what happened behind this case, we don't know exactly. But first of all, the patient criteria selection is very important. First of all, the patient and clients only, they are doing the first wrong mistake and step. So this case mainly that was happened in the not only in the professional clinics. So this happened only the non-professional, some beauty parlors. So my humble request, please patients and whatever the anyone they want the hair transplantation, please you can go and select the proper professional doctors, and please can you visit to only the professional and proper clinics, because that patient maybe so many patients they are going to unprofessional clinics like the beauty parlor and that kind of clinics, and they are getting lot of side effects, even though death also. So because of that, the society, those kind of people only they are going to non-professional clinics and they are undergoing the transplantation and they are getting the hair transplantation. Because of those cases in the society, every patient and every client, they are the panic and they are getting the panic. First of all, you can select the proper clinics. Hair transplantation, mainly this procedure can do only the dermatologist and the plastic surgeons only. But nowadays, so many clinics in the society, they are coming like the cosmetic clinic, cosmetologist and the hair transplanted clinic. Please don't select those kind of clinics. And hair transplantation is a really very minimal in the OPD procedure. There is no side effect and 100% it is a very safe. But in case unprofessional doctors, unprofessional clinics, if they do, it is a 101%. It's a very unsafe, and you will, and the patient they will get the death also. Generally, professional doctors like the dermatologist and the plastic surgeon, what we do know that before the hair transplantation, we are checking the pre-operative patient care. So we need to evaluate other patient they are having the any diabetic or any metabolic disorders like the hypertensive, diabetic and thyroid and any other issues. But other clinics and unprofessional doctors, they can't do like this. And the second thing, during the procedure we are use the proper local anesthesia and the tumescent anesthesia. But other clinics and other professional doctors, they don't know proper how to use the mix the local anesthesia and the tumescent anesthesia, because the most of side effect are coming with the local anesthetic agents and the tumescent agents. There are the different patient to patient variation in the during the treatment medication also. But in unprofessional clinics, they don't know proper knowledge. They know only the practical knowledge, only like the RNP. Because of that, they are applying for every patient the same scenario, same medication, same doses. Because of that, the so many patients, they are getting the complications, side effect, and even though post-discharge complication also they are getting. So first of all, we have to evaluate proper the pre-operative patient condition. The second thing, patient to patient, there are the different medication during the procedure like the local anesthesia and the tumescent anesthesia. So if the patient they are having the hypertensive, so according to hypertensive we have to properly use the dose medication. If the patient they are having the diabetic, according to diabetic we have to do the procedures. And if the patient thyroid, according to thyroid we have to use the medication during the procedure. But this kind of knowledge unprofessional clinics they don't know. Because of that point of view also the patient getting the complications. And the second thing, post and during the procedure we need to evaluate proper the OT setup, because so many patients they are getting the post operative complication death. Because we need to proper sterilization in the clinic, and this hair transplant technique, it is not only the single doctor dependence, it is a complete unit, because we need to along with doctors some technicians, staff members also we need. All together only we can finish the transplantation. So we can care proper along with doctors, staff sterilization also very important, and the OT sterilization is very important, and the same time instrumentation sterilization also very important. So this all the setup the outside the clinic, they are not maintained proper hygienic setup. Because of that kind of only the patient they are getting the side effect post discharge after the transplantation even though. Please again my humble request, everyone, if they want to go the transplantation, please don't select the unprofessional clinics, don't follow the ads, don't follow the any YouTube ads and everything. You can follow only the dermatologist based clinic and otherwise the plastic surgeon based. Out of these two categories, please don't go the transplantation techniques and procedures. Because of improper selection of clinic setup and so many complications, side effects and death are you are getting, you are creating the panic in the society. Please, transplantation is a very simple and safe technique. You go the select the proper doctors only, then you will, every patient they are the safe. Otherwise, other than these two category doctors, you will get the complication and side effect. So please don't be panic everyone. If the patient they are having the baldness, you can simply go to the dermatologist and plastic surgeon for the treatment. There is no side effect, nothing. It's a very simple technique. Within 5 to 7 hours, we can finish the treatment. Even though during the procedure also there is no side effect. Even though after procedure also no side effect. So please don't be panic. It's a very safe technique.